Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of subarachnoid hemorrhage. Treatment of subarachnoid hemorrhage. In the treatment of subarachnoid hemorrhage, medical support should be given. Medical support, like we should give airway protection to the patient, and in the circulation, blood pressure monitoring is important, and blood pressure management should be important. We should prevent vasospasm also. This vasospasm is mainly prevented by the drugs like nimodipine can be used for vasospasm prevention, and we can also use volume expansion also. Then then we also have triple H method of treatment. Okay, in triple H method of treatment, actually in triple H method of treatment we have hypotension, then we have hemodilution. Okay, we will have to maintain hypotension in the patient. Hemodilution should be maintained by giving uh, fluids, and also hypervolemia. Hypervolemia is created by giving fluids. So this is one method of so hypertension, not hypertension. So this is called as triple H method, where we make the patient hypertensive with hemodilution and hypervolemia. Then, in some cases, we can also give phenytoin. Phenytoin can be given mainly as a prophylactic therapy for seizure prevention, because seizures can develop due to the subarachnoid hemorrhage. So, to prevent seizures, we can give prophylactic therapy of phenytoin. Then, surgery can be done. In the surgery, clipping of aneurysm is also indicated in surgery. Then, we have recent advances. In the recent advances, we have endovascular coiling is done in the recent advances, which is embolization can be done. And in endovascular coiling, we will actually use a catheter, and we will clog up the site of bleeding. The bleeding site will be clogged with the help of the catheter, and then you will do this endovascular coiling, that is endovascular coiling. Then second procedure is, we can also do one more procedure which is called as surgical clipping is done. Among both this, which is most preferred? Actually, endovascular coiling is superior to surgical clipping in most of the conditions. So in endovascular coiling, it is a process of embolization, where actually this is the aneurysm, right? We will pass a coil through it, and whenever there is a bleeding here, first you will clear up the bleeding site, and then you will make this aneurysm to be embolized. Okay.
thank you and thank you for watching.